Then I would ask, can you tell me the year?
2013.
And can you tell me where we are?
We are at nursing college.
Okay. Okay, so I've checked orientation. She is oriented to person, place, and time, ×3. And I've also assessed level of consciousness using the Glasgow-Coma scale. You should know that. There are 3 areas to it: eye, verbal, and motor. I believe eye is 4, verbal is 5, and motor is 6. So eye, she looked at me when I spoke to her. Verbal, she responded appropriately. Motor, she was able to turn her head. There weren't any movements that didn't make any sense. She was able to do everything, so she got the max, which is 15, okay? In addition to that, I also assessed her behavior. She was cooperative. Her speech, the pattern was of a normal speech. It wasn't a hurried or a slow speech. While I was talking to her, I also assessed that she wasn't wearing any glasses. You wear contacts. And she doesn't have any hearing aids in, okay? Right off the bat, that's what you should do, okay? So once I've done that, I'm done. I'm going to go ahead and I'm going to start my physical assessment, okay? Everybody wants to start pulling out their stethoscope and their pen light, and they want to start grabbing supplies, okay? The first thing you should do with whatever area that you start with is you should be looking, okay? I'm going to look. I'm going to look. I'm inspecting, okay? So with each area, you're going to start at the top and you're going to move down. I'm going to start at the top. I'm looking at the head. I'm inspecting, okay? I'm looking. I'm looking at her skin. I'm looking for any breaks in her skin, any infection, any scars, any tattoos. I'm just looking, okay? Once I've looked at her skin, then I'll go ahead and I'll do the eyes. Does anybody have a pen light? All right, pen light. You're going to look at her pupils, okay? And I usually start at this side, and it's easier when you turn the lights off, so that way light isn't, go ahead and lean your head back. And I'm gonna go ahead and look, and I'll start over here. Sometimes, all right. I'm looking at her eyes. Okay. When I'm looking at her pupils, I'm using the acronym PERRLA, P-E-R-R-L-A. Are the pupils equal? Are they round? Do they react to light? A is accommodation, and I'm not expecting you to do accommodation, but you do need to know that acronym. I've looked at her pupils, and I've assessed them using PERRLA. Okay, after I'm done with her eyes, I'm going to move down to her mouth. Then I'm going to look at her mouth. I'm looking for any cracks, any cuts. I'm looking at the color. I'm looking at for any dryness. I'm looking at her lips. Now I'm going to go ahead and have them open their mouth. Go ahead and open your mouth. I'm looking inside. I'm looking for dentures, any partials, any tongue piercings, any ulcers. I'm looking for a coating on the tongue. I'm looking at the color. I'm looking at the moisture of the mucous membrane. I'm looking. I've looked, okay? I'm done. I'm moving down to her neck. And the first thing I do is what? I look, right? I'm looking. With each area, I'm looking. So I'm looking at her neck. I'm looking for any JVD, jugular vein distension. I'm looking at her trach to make sure that it is in the middle, that it's medial. I'm looking for any swelling, any scars, any tattoos. I'm looking at her neck, okay? Now I'm done looking at her neck. The next thing I'm going to do is I'm going to put my hands on her and I'm going to feel, okay? So I'm feeling the lymph nodes. I'm feeling for any tenderness or any swelling, and I'll call them out. Cervical, submandibular, submental, supraclavicular, you should know some areas, okay? At least 4. Okay. I have felt, okay? Any tenderness, any swelling. I'm done with her neck. Now I'm going to move down to her chest, and what's the first thing I'm going to do?
Look.
I'm looking, right? I'm inspecting. So I'm looking. So, you know, normally you would have your patient disrobe so you could actually see, but you're not going to do that. So the first thing I'm going to do is I'm looking at her chest. I'm looking for any swelling, any tenderness, any breaks in the skin, any scars, any tattoos. I'm looking, okay? I've looked at her chest. Now I'm going to listen. Use this, okay? I don't care if you start with heart sounds first or lung sounds. I don't care. Whatever one you want to start with, okay? I'm going to go and I'll start with heart sounds. I'm going to move this. This is pretty. I like this. Okay. So I'm going to listen to heart sounds. You need to know how to locate those heart sounds, okay? So I'm going to look for sternal notch, okay? Angle of Louis. Angle of Louis. Over to the right, I'm at my second intercostal space. This is my aortic, okay? And I would go ahead and, when you're doing your physical assessment and I'm testing you, don't have to actually listen. I just want you to have your stethoscope on, how you have your ears on. And I'd want you to locate and tell me, I'm at the aortic, and I'm noting rate and rhythm, okay, aortic. I go over to my left, I'm still at my second intercostal, and I'm listening pulmonic. I'm gonna count down to fifth. 2, 3, 4, 5. And I am lateral to the sternum, and I'm listening to my tricuspid. I go mid-clavicular, I'm still at my fifth intercostal, and I'm listening to mitral or apical, and I would listen for a full minute. Okay? All right. Heart sounds are done. I'm now going to listen to my lung sounds. I'm expecting 6 areas. I think your book has 8. You only have to listen to 6. And you're going to call it out. I'm going to listen for bronchial sounds. I'm noting rate, rhythm. I think there's character in there. Rate, rhythm, character. I'm not sure. Okay, bronchial sounds. I'm listening bronchovesicular. You don't count. There's no counting, okay? Bronchovesicular. 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 Vesicular. Vesicular. Okay. I think it's like rate, rhythm, character, I think. I'm not sure. But you do need to say what you're listening for, okay? I'm done with my chest. I'm moving to my abdomen, and when I get to my abdomen, the first thing I do is
Inspect.
I'm inspecting, I'm looking, okay? And I disrobe their belly. I'm looking for any distension. I'm looking to see if it's taut. I'm looking if there are any scars, for any tubes, or any tattoos, any breaks in the skin, any discoloration. I'm looking. Once I've looked at the abdomen, the next thing I'm going to do is I'm going to listen. And you're going to call out the quadrants because I want you to be familiar with the anatomy. Right upper. Make sure there's coastal margins. Okay, here's the ribs. Look for their coastal margins to make sure that you're actually in their abdomen. Coastal margin. I'm sorry.
No, you're fine.
Her pelvis is here, okay? Coastal margin, so this is her abdomen. Sometimes I see students and they're like way up here on the ribs. Make sure you're in the belly, okay? Okay. Right upper, I don't care where you, well, let me back up. Before I start listening, I ask my patient, do you have any pain in your belly? Do you have any pain in your belly? When was your last bowel movement? She's like, yeah.
This morning.
Okay, so you ask your patient that. If she says, yeah, I'm having some discomfort over here, that would be the last area, okay? Wherever they're having pain, that's the last area you should be listening to or touching, okay? Because you want to do a